All right, so by popular request, this is going to be a really quick and dirty version of how I show patients how to use a tool called a pelvic wand. So this particular pelvic wand is the brand New Flora. There are several different wands. I usually recommend a silicone wand. There are plastic wands and there are metal wands, but for most folks, I will recommend this, a silicone option. This one is non-vibrating. They do come in vibrating options as well, which can be really helpful if you have a high pain level. But if we're just stretching tissue, usually you can get away with just a regular pelvic wand. You can use either end of the wand, and then you can use these vaginally or rectally, depending on your anatomy. So for today, I'm going to show you on a model with a vulva. So first, I'm going to just show you how you can use this on the outside. Okay, so here we have our vulva. You can use this almost like a massager. So we've got some muscle here, okay? So we can do some gentle pressing and release of these muscles on the outside. Okay. Now you can also use these to stretch the perineum, this area right here, before childbirth. So usually if I have patients who are pregnant, I'll instruct them there's a certain point in pregnancy where we want to start working on stretching this tissue because this is where most commonly the tissue tears during childbirth or where there's an episiotomy. I'm going to switch to a different model only because that one is not flexible. So here we have another model. This is your tailbone. Okay, so this is the inside of your pelvic bowl. And right here is the pubic symphysis. So your bladder sits right behind this inside. This area commonly can be disrupted during pregnancy. Some people have pubic symphysis pain. So here we have the vaginal opening. We'll go look at this way. So this is looking at a body from the outside. Okay, so if you are lying flat on a mattress, you would have the vaginal opening here. And then this is the rectal opening. Okay, so we're going to do intravaginal release today. So we're going to use either end. Now, depending on your tightness, your tenderness, where that is, and where your pelvic floor therapist has instructed you, you may use either end. If we need to get in a little bit farther, we're going to use this longer end. If we don't need to get in that far, we're going to use this end. So you are lying down. Now, I usually will have patients hold the farther end, and we're going to go inside. Okay, so now if I want to get into my left side, my muscles on my left side, I'm going to use this as almost like a lever to get on the left side of my body. Okay, now if I wanted to maybe do the right side, I would go in, tilt this to the right, and then use this as a lever. So basically, whatever's on the outside of your body, so say your entry, right, vaginal opening. Okay, so here's my opening, I'm going in, and if I wanted to, say, stretch my left side, I would have to leverage and pull towards the right. So it takes a little bit of that, like, kind of visual, okay? Same thing on the other side. If I wanted to get into my right side, I would go in, and then I would gently pull this outer surface towards the left to point to the right. I usually have folks do somewhat of a sweeping motion. Okay, so sometimes we'll do some sweeping along the muscle belly. Okay, sometimes we'll do some pressing. Sometimes we can even do some circles. Okay, now if you have hip rotator specific tightness, okay, your hip rotators are farther back. Those are not true pelvic floor muscles, but they're friends of the pelvic floor. So we might be getting way into that piriformis. Or for some folks, we might be getting over here into this obturator internus. This one is a juicy little friend of the pelvic floor. It can get really tight, can pull us into external rotation. So this one's more kind of a little bit towards the front. Not totally towards the front, but a little bit more towards the front, thinking of pointing more towards your hip. Okay. Now, of course, I always recommend that if you're going to use a pelvic wand, please see a pelvic floor therapist so that way you can be best guided into how to use this on your own. That way you can bring it into your appointment, you can bring it into the clinic, you can troubleshoot it with your therapist one-on-one. This is not meant to be a diagnostic, and this is not meant to be all-encompassing on how to use a pelvic wand. If you have concerns, questions, please see your healthcare provider. Please go to see your doctor, or feel free to show this video to your pelvic floor therapist. And please leave a comment if I can help you in any way or provide you with any resources.